Usually when we talk about human anatomy, we tend to think of it like a machine.
Right, like gears and cogs.
Exactly. Use a machine too much, the gears wear down, the springs get loose, and eventually it needs parts replaced.
That's the standard logic, yeah.
Right. So we just assume that preserving the body means protecting it from wear and tear. But then you look at certain biological systems, and suddenly that mechanical logic is just completely flipped on its head.
Oh, absolutely flipped.
Because we are looking at an anatomical landscape where inactivity does not preserve the system at all. In fact, inactivity might actually be the very thing that causes it to break down.
Which is so counterintuitive for a lot of people.
It really is. And today, we are tackling a very provocative question that you, the listener, brought to us. And that is, can sexual inactivity make the vagina feel tighter or looser?
It's honestly a brilliant question to ask, primarily because, well, the answer requires us to completely dismantle some very deeply ingrained cultural ideas about human anatomy.
Yeah, we have a really fascinating stack of medical sources for this deep dive. We're pulling from the British Menopause Society, Harvard Health, the Cleveland Clinic, because our mission today is to cut through those cultural myths and explore the actual biology of vaginal health, elasticity, and what happens when you literally use it or lose it.
And we like simple mechanics. The idea that if you leave something alone, it stays in this pristine, original condition feels intuitive. But biology rarely follows that logic.
Not at all.
And exploring the actual mechanisms here is the ultimate shortcut to being well-informed about your own body. Because when you understand the why behind the symptoms, it takes away the fear and the stigma that usually surround this topic.
Okay, let's unpack this, because before we can even answer how sexual inactivity changes things, we first need to establish what tightness and looseness actually mean biologically.
Right, because our culture gets it completely backward.
Completely. Look through the research, particularly an excellent breakdown from the Clue app. There is this persistent myth that frequent penetrative sex or using tampons or menstrual cups will permanently stretch out the vagina.
Yes, the classic pair of shoes analogy.
Exactly. The idea that the vagina is like a pair of new leather shoes that get permanently broken in and loose over time.
And that leather shoe analogy is exactly what we need to throw out the window.
Right out.
Because the non-muscular vaginal canal is incredibly dynamic. Its size and shape actually change throughout a person's menstrual cycle. The tissue is highly elastic, biologically designed to stretch immensely.
I mean, sometimes enough to allow a baby to pass through.
Exactly, and then return to its original shape.
So it's much more like a high-quality rubber band, not leather shoes. It stretches to accommodate, but its resting state remains relatively constant.
That's a perfect way to look at it.
But wait, if frequent sex doesn't make things permanently loose, then where did the idea that inactivity makes you tight come from? I mean, is there any biological truth to that?
What's fascinating here is that there actually is a physical narrowing that can happen with inactivity. But it is a medical condition, not some cultural ideal.
Right, not a return to some pristine virginity state.
Exactly. The physical feeling of tightness during sex, under normal circumstances, is actually dictated by two distinct factors: physiological arousal and the pelvic floor muscles.
Okay, break that down for us.
Well, when a person becomes highly aroused, the parasympathetic nervous system kicks in. This triggers increased blood flow, but it also signals the pelvic floor muscles to relax.
So the vaginal space actually elongates and becomes less constricted.
Yes, it literally feels looser and more accommodating when you are turned on.
Which means the cultural obsession with tightness equating to better sex is just deeply flawed.
Deeply flawed. If things feel incredibly tight, it might actually mean the person isn't fully aroused or their muscles are tensing up due to anxiety or discomfort.
Right, because true sexual pleasure relies on arousal and lubrication, which physiologically create a more relaxed, open environment.
And this leads directly into what actually causes the pathological, physical narrowing and tightening. It's usually a drop in estrogen combined with sexual inactivity.
This brings us to a major focus of our research today. The medical term is genitourinary syndrome of menopause, or GSM.
Yes, GSM.
And for anyone listening who isn't familiar with the term syndrome in a medical context, it essentially means a collection of interconnected symptoms that all stem from the same root cause.
Right, and in this case, the root cause is wreaking havoc on both the genital and urinary tracts.
And the numbers surrounding GSM are staggering, aren't they?
They really are. It affects 1 in 4 women leading up to menopause and 1 in 2 women afterward. By the time women are in their 70s, 70% of them are dealing with this syndrome.
70%. That is a massive portion of the population.
Yet it remains historically underreported. To understand why the vagina might actually narrow and tighten in a painful way, we have to look at what estrogen does for this specific tissue.
Estrogen really is the fuel that keeps this entire ecosystem running. It keeps the vaginal walls thick, elastic, and hydrated.
It supports collagen production, too, and it encourages the cells lining the vagina to turn over and shed regularly.
Let's slow down and look at the microscopic cascade here, because this was a massive aha moment for me in the research.
Oh, the glycogen cycle. It's fascinating.
Yes, in a well-estrogenized vagina, the superficial epithelial cells shed every few hours. And when those cells shed, they release a complex sugar called glycogen.
And that glycogen acts as the primary food source for the dominant good bacteria in the vagina, the lactobacilli.
Right, the good bacteria eat the sugar.
Exactly. They consume the glycogen, and as a byproduct, they produce lactic acid. This keeps the vaginal pH remarkably low, usually between 3.8 and 4.5.
Which is pretty acidic.
Very acidic. That acidic environment functions as an invisible self-cleaning shield. It makes the environment completely inhospitable to harmful bacteria and yeast.
But when estrogen levels drop, that entire supply chain just breaks down. The tissue thins out, which means there are fewer superficial cells.
Right, and those cells stop shedding as much.
So the glycogen supply dries up.
And without glycogen, the lactobacilli literally starve to death.
Wow.
As that good bacteria dies off, the pH of the vagina inevitably rises above 5.0. That highly acidic shield is suddenly gone.
Which just opens the door for commensal organisms like E. coli from the digestive tract just migrate and take over.
Exactly. This is why a drop in estrogen so frequently invites recurrent urinary tract infections, strange discharges, and just intense chronic irritation.
So while that microscopic warfare is happening on the surface, the physical structure of the vagina itself is deteriorating underneath.
It is. The research details how the fibroblasts, the specific cells responsible for producing collagen, they just become dormant.
And the elastin fibers begin to fragment.
Yes, and without that structural support and without the hydration that estrogen brings, the vaginal walls can literally become shorter and narrower.
And that specific structural narrowing is called vaginal stenosis.
Right. Because the tissues are thinning and losing their stretch, they become incredibly fragile. A healthy vagina has natural folds called rugae.
Kind of like accordion, right? It allows it to expand.
Exactly like an accordion. Vaginal stenosis smooths those folds out entirely.
Oh, wow. So it just loses its elasticity completely.
Completely. This is what creates that sharp, painful sensation of tightness or even tearing during penetration. The tissue has simply lost its mechanical ability to yield.
So inactivity does make the vagina tighter, but it's actually stenosis or atrophy, which means it's losing its stretch and becoming fragile.
That's exactly it.
But why is this only talked about as a menopause issue if it can happen to anyone? I mean, how does sexual inactivity specifically accelerate this?
Well, sexual activity, whether with a partner or through masturbation, it acts as a biological workout for the tissue.
Workout. I love that phrasing.
It dramatically increases blood flow to the pelvic region, and that rush of blood brings vital oxygen and nutrients to the vaginal tissues.
Furthermore, the mechanical stretching that happens during penetration actually stimulates those fibroblasts we talked about.
Yes, keeping the collagen and elastin fibers active and healthy.
It really is a literal case of use it or lose it. Inactivity restricts that vital blood flow.
And if you combine a drop in estrogen with a lack of regular sexual stimulation, you are fast-tracking the shrinking, the thinning, and the narrowing of the vaginal canal.
Going back to my question, if this is driven by estrogen and inactivity, menopause isn't the only trigger, right?
Not at all. Menopause is simply the most predictable trigger. But this exact same physiological process, the thinning, the pH shift, the narrowing, can happen at other stages of life.
Like when?
Well, it can happen temporarily during breastfeeding when estrogen is naturally suppressed to prioritize milk production.
Oh, I see. Or it could happen surgically, right? If someone has their ovaries removed, it triggers a very sudden and often much more severe drop in estrogen compared to natural menopause.
Yes, exactly. We also see this frequently following certain cancer treatments.
Like chemo and radiation.
Right. Pelvic radiation can directly damage the tissues and blood vessels, leading to severe scarring and radiation-induced vaginal stenosis. Chemotherapy can put the ovaries into early failure.
And the research also mentions certain hormonal therapies, specifically aromatase inhibitors used for breast cancer. They are designed to purposefully block estrogen throughout the entire body.
which naturally induces these severe atrophic changes in the vaginal tissue.
So if you are listening to this and wondering if it applies to you, the key takeaway so far is that anyone experiencing a sustained drop in estrogen, combined with a period of sexual inactivity, is at risk for this painful narrowing.
Absolutely anyone.
But we've focused really heavily on the skin,
Yeah.
the mucosa and the collagen. The vagina isn't just a tube of skin.
No, it's suspended within a complex hammock of muscles.
Here's where it gets really interesting, because inactivity can trigger a vicious cycle of both extreme looseness and extreme painful tightness in those muscles.
The pelvic floor is a highly specialized group of muscles and ligaments. They form a sling at the bottom of the pelvis, supporting the bladder, the uterus, and the bowel.
And just like your biceps or your quads, these muscles are designed to contract and relax.
And they are vulnerable to the exact same wear, tear, and atrophy as any other muscle group in your body.
Let's explore the looseness first. The sources from Harvard Health and the Cleveland Clinic point out that pelvic floor muscles naturally weaken with age.
They do. They can also be damaged or overstretched during vaginal childbirth.
And even something as seemingly unrelated as chronic constipation, like constantly pushing and straining, can severely weaken them over time.
When those muscles lose their tone, the immediate result is a loose, less grippy environment in the vaginal canal.
But the more severe consequence is that the organs those muscles are supposed to be holding up start to lose their fight against gravity.
Yes, this is what leads to pelvic organ prolapse.
And that affects about 50% of postmenopausal women, right?
Yeah.
They develop a very weak front wall in their vagina.
Right. And because of that structural weakness, the bladder or the uterus can literally fall downward and bulge into the vaginal space.
It creates a physical dragging sensation, a feeling of heaviness.
And often leads to stress urinary incontinence, leaking urine when you cough, sneeze, or laugh.
In this scenario, age, physical trauma, and a lack of targeted muscle conditioning lead to a highly problematic looseness that drastically impacts a person's quality of life.
But the exact opposite can also happen within that same muscle group. The muscles can go completely rogue in the other direction.
Instead of getting weak and loose, they become hyperactive and locked in a permanent state of tension.
This manifestation of an overactive pelvic floor is often diagnosed as vaginismus. The muscles surrounding the outer third of the vagina spasm involuntarily.
It makes penetration feel incredibly tight, often causing a burning sensation, and can make sex physically impossible. I mean, think about a time when you were under immense stress and you unknowingly clenched your jaw all day. By the evening, your teeth ache, your jaw is locked, you have a massive headache. Now, imagine that involuntary sustained clenching happening deep in your pelvis.
It's a great analogy.
But I'm curious about the mechanism here. Is that pelvic muscle locks a conscious signal from the brain saying danger, or is it a localized reflex happening entirely on its own?
It's a fascinating interplay between the two. Initially, it might start as a localized response to pain. Say the tissue is dry from a lack of estrogen tearing slightly.
Right.
When a muscle is constantly contracted, it restricts its own blood supply. This causes ischemia, which is a localized starvation of oxygen to the tissue.
And when muscles don't get enough oxygen, they produce metabolic waste products like lactic acid, which rapidly build up in the tissue.
Exactly. And those accumulated metabolites act as chemical triggers, setting off the pain sensors that send a screaming signal up to your brain.
That's where the brain takes over and turns it into a psychological loop.
If we connect this to the bigger picture, when we feel pain, or even just anticipate pain, our central nervous system triggers a protective guarding reflex.
So if sex hurt the last time you tried it, your brain remembers that trauma.
Yes, and the next time you attempt intimacy, your fear and anxiety cause those pelvic floor muscles to clench even tighter before anything even happens, as a preemptive protective mechanism.
It creates a devastating self-fulfilling prophecy. The fear of pain causes the brain to signal the muscles to clench, which causes ischemia and cuts off the blood flow.
Which causes severe physical pain, which makes sex impossible.
And that leads directly back to sexual inactivity, which, as we just established, deprives the vaginal tissues of the blood flow of mechanical stretching they desperately need to stay healthy, thereby accelerating the atrophy and the stenosis.
The emotional and psychological toll of this cycle cannot be overstated. The clinical sources emphasize how completely this disrupts a person's life.
It creates profound emotional disconnects in relationships.
People stop biking, they alter their wardrobes, and they dread routine medical exams like pap smears because the speculum is excruciatingly painful.
And the most tragic part is that 60% of postmenopausal women have physical, visible evidence of vaginal atrophy, but only 7% get treated.
Only 7%. They endure it because they are too embarrassed to speak up or because they mistakenly believe that painful sex and urinary incontinence are just inevitable, irreversible parts of aging.
But the reality in this research is that these changes are not permanent death sentences for your anatomy. There are highly effective, evidence-based interventions to reverse the clock, restore the tissue, and calm those hyperactive muscles.
There absolutely are.
But I have to push back a little on the feasibility of this. I mean, isn't it overwhelming for the listener to figure out which of these to use? Where does someone even start?
Well, medical professionals utilize a stepped approach, starting with the least invasive methods. And the foundational step is quite literally vaginal exercise.
Because blood flow is medicine for the vagina.
Exactly. Regular sexual stimulation, whether with a partner, alone, or using a vibrator, is prescribed to promote that vital circulation.
But for people who are already experiencing severe narrowing or stenosis, especially those recovering from radiation or surgery, normal touch might be too painful.
Right, which is why the standard medical recommendation there is vaginal dilator therapy. These are smooth, tube-shaped devices that come in a series of graduated sizes.
The goal isn't to aggressively stretch things out all at once, which would just cause more micro-tearing and pain.
No, the patient uses them gently, usually for a few minutes a day with generous amounts of water-based lubricant to slowly, mechanically stretch the tissues.
But crucially, dilator therapy is also about retraining the nervous system, isn't it?
Yes, by controlling the depth and pace, the patient teaches their brain and those hyperactive pelvic floor muscles that penetration can happen without pain. It breaks the anxiety pain cycle.
Which brings us to the actual environment of the vagina and the products we put in it. I learned from this deep dive that there is a massive biological difference between lubricants and moisturizers.
The distinction is vital. Lubricants are designed strictly for the time of sexual activity to temporarily reduce friction.
And water-based lubricants are generally the safest option, especially since oil-based lubricants can compromise latex condoms.
And potentially disrupt the vaginal microbiome, but moisturizers are an entirely different therapy.
You use them 2 to 4 times a week, independently of sexual activity, kind of like you would use a daily face cream to maintain hydration.
Exactly. They absorb directly into the mucosal tissue and mimic natural vaginal secretions. But you have to be incredibly careful about the chemistry of the moisturizer you choose.
Right, you need a product that is not only pH balanced to support that acidic shields we talked about, but you also need to check its osmolality.
Osmolality refers to the concentration of particles in a fluid. The ideal osmolality for vaginal tissues is between 260 and 290 milliosmoles per kilogram.
And to visualize why this matters, the sources had a great analogy. Imagine putting a plump grape into a glass of heavily salted water.
Because the salt water has a higher concentration of particles, it pulls the water out of the grape, causing it to shrivel.
Oh, wow. So if a vaginal moisturizer is hyperosmolar, meaning it's too highly concentrated, it will actually pull water out of your already fragile cells.
Causing cellular damage and severely worsening the dryness.
That is such a crucial piece of knowledge. But what if the lifestyle changes? The dilators and the perfectly osmolality-checked moisturizers just aren't moving the needle.
Yeah.
What if the atrophy is so severe that the tissue just isn't responding?
When over-the-counter methods fall short, we turn to low-dose local estrogen. For genitourinary syndrome of menopause, this is often the gold standard of treatment.
And it is available in various forms, right? Like creams such as Estress that are applied directly.
Or small tablets like Vagifem that are inserted, or a flexible silicone ring called S-string that rests inside and releases a continuous microdose of estrogen over 3 months.
I know the phrase hormone replacement therapy often triggers hesitation because of the complicated history and systemic risks associated with it, like breast cancer or blood clots.
That is a very valid concern to have, but local vaginal estrogen is biologically distinct from systemic HRT. It is applied directly to the affected tissues, and the dosage is incredibly low.
So it operates locally to wake up those dormant fibroblasts, restore the thickness of the tissue, bring back the glycogen supply, normalize the pH, and stop the recurrent urinary tract infections.
Yes, and it achieves all of this tissue regeneration with negligible absorption into the rest of the bloodstream.
But for those who cannot use estrogen, or just prefer not to, the research outlines some fascinating advanced interventions. We are talking about treatments like fractional CO2 lasers, such as the Mona Lisa Touch.
Yes, from a patient perspective, they use a wand to deliver laser energy that creates microscopic wounds in the vaginal tissue.
It sounds totally counterintuitive to create wounds.
It does, but it triggers the body's natural healing cascade. The trauma stimulates the fibroblasts to rush to the area and aggressively produce fresh collagen and new blood vessels.
There is also platelet-rich plasma, or PRP therapy, where a doctor isolates growth factors from your own blood and injects them directly into the vaginal walls to stimulate rapid cellular regeneration.
And if the primary issue is rooted in those tight, spasming muscles rather than just the tissue, a referral to a pelvic floor physical therapist is essential.
Right, they use manual therapies to physically release those muscle knots and teach the patient how to actively relax their pelvic floor.
So there are many options.
So, to bring it all back to where we started, we asked if sexual inactivity can make the vagina feel tighter or looser. And the answer is a resounding, complicated yes to both.
Yes to both. Inactivity, when combined with aging, physical trauma, and muscle weakness, can lead to a loose, unsupported environment resulting in pelvic organ prolapse.
But inactivity, when combined with estrogen loss, can lead to severe structural narrowing, tissue fragility, and painfully tight muscle spasms.
The ultimate takeaway is that the vagina is not a machine that stays perfectly preserved if you lock it away in a box.
Sexual inactivity doesn't preserve your body in some pristine state. In fact, a lack of regular stimulation, especially when combined with inevitable hormonal shifts, can lead to a loss of elasticity, painful stenosis, and a complete disruption of your urinary and sexual health.
It is living, breathing tissue. Just as you wouldn't expect your leg muscles to stay strong and flexible if you sat on the couch for a decade, we cannot expect pelvic tissues to maintain their elasticity and vascularity without regular, engaging use.
So what does this all mean?
Well, if our culture stopped viewing female sexual activity through a lens of taboo or wear and tear, and instead recognized it as a necessary biological workout for tissue health and longevity, how radically would that change the way we approach aging and healthcare for half the population?
That is an incredible thought to leave on. The idea that reframing this one specific, often stigmatized part of the anatomy could radically change healthcare is just mind-blowing. Thank you for joining us on this deep dive. I hope this gave you a new appreciation for the dynamic resilience of the human body and armed you with the knowledge to understand your own biology better. Keep learning, keep questioning the myths, and stay curious. We'll catch you next time.